Dr. John Barbieri, a dermatologist at Brigham and Women's Hospital in Boston, Massachusetts. And at the AAD this year, I've given some lectures on the use of spironolactone for acne. When we think about some of the new data we have on spironolactone, it's really exciting. Over the past couple of years, we finally started to get some very robust clinical trials demonstrating the effectiveness of spironolactone for acne and also giving us some more data on side effects. From the SAFA trial in the UK, it found that spironolactone was significantly effective at improving quality of life and acne global assessments. And also, we got a sense of what the true side effect profile is. At 100 milligrams a day, about 5% of people had issues like dizziness or lightheadedness. There was some headache, but we really actually didn't see much of a signal for irregular menstrual cycles. And so this is something we often worry about with spironolactone, but it kind of highlights that at these lower doses, it may more reflect underlying predispositions in the population of adult women with acne more than a true spironolactone effect. When it comes to dosing spironolactone, it seems like doses 100 to 150 milligrams a day tend to be the best at balancing efficacy and side effects. Some patients will clear a little bit more in 150 milligrams a day. Usually side effects, especially irregular menstrual cycles, a little bit less on 100 milligrams a day. So starting somewhere around 100 milligrams a day and then going up to 150 or even 200 milligrams a day as needed can be a good way to dose spironolactone. We're now getting some nice comparative effectiveness data comparing it to oral antibiotics for acne, which is really important because spironolactone and other hormonal therapies like combined oral contraceptives can be a great alternative to oral antibiotics for women with acne. And what we see in the FASCE trial from France was that at 6 months of treatment, spironolactone actually did a little bit better than the antibiotic arm in that trial. And at 2 and 4 months, they were relatively similar. So this really supports that spironolactone can be an excellent alternative to oral antibiotics and help us practice better antibiotic stewardship and avoid antibiotic-associated complications for our patients with acne. Then finally, with respect to spironolactone, we have opportunities to improve our use of lab monitoring. So among young, healthy individuals with spironolactone, the value of lab monitoring is relatively low and it may not be needed. However, in older populations or those with risk factors like medications or kidney disease or other comorbidities that might increase the risk of hyperkalemia, that's where checking potassium and lab monitoring may be more useful. When we're going to lab monitor in the setting of spironolactone, we really want to make sure we're doing it about 1 to 2 weeks after starting. Changes to potassium hyperkalemia typically occur early. And when we look at monitoring practices in other areas like cardiology, that's typically what they recommend. However, in dermatology, we're often checking potassium a few months after people start. And this is not ideal because that means if someone is having hyperkalemia, we're not identifying and addressing it for a prolonged period of time. So while lab monitoring is of low usefulness for many individuals being treated with spironolactone, when we are going to check it, we want to make sure that we do it within a couple of weeks of starting spironolactone. Then finally, some concerns around spironolactone, such as risk of cancer and other kinds of problems like that. Generally, the literature we have to date has been very reassuring that spironolactone doesn't appear to be associated with increased risk of cancer. And in fact, oral antibiotics may be associated with an increased risk of colon polyps and colon cancer. So again, when we're making that decision about whether to use oral antibiotics or spironolactone, these are some more data that really support that spironolactone can be a safe and effective alternative to oral antibiotics for adult women with acne and adolescent women with acne as well.